We're looking back on some of our Nevada Week discussions throughout 2020 as a means to look towards 2021. That's this week on Nevada Week.
Support for Nevada Week is provided by Senator William H. Hernstadt and additional supporting sponsors.
It's been a trying and for many a very tragic year that many social media memes implore us to forget. But in true Nevada Week spirit, looking back on 2020 can provide some good context for a brighter 2021. Because news and information change so quickly this year, you might assume these conversations are outdated. But we found some very meaningful discussions relevant to current events today and what's coming in 2021. First up, Tony Hsieh's life and death brought national attention to downtown Las Vegas's revitalization efforts, and COVID-19 brought local concerns for its survival. Well, way back in January, before COVID-19 hit Nevada, we sat down with leaders to discuss downtown Las Vegas. Our conversations around Tony Hsieh's legacy and the importance of locals to downtown seem all the more poignant now. Take a look. Tony Hsieh put $350 million of his own private funds into this to invest about 10 years ago. What are some of the successes of that phase of development here in downtown?
Well, I think probably for me personally, watching Container Park and seeing Container Park, that really I feel like was a big pivot point for downtown, where the past and there was a lot of stigma behind drugs and the just prostitution, other seedy elements of downtown, and to take and put something like that in the middle of what was happening in downtown and say, this is somewhere families can go, this is a place for children to go and play, was really, I think, a turning point in what was happening with downtown, and I think helped to create the vision of where downtown was going.
We're concentrating on that first block of Fremont in between 5th and 6th, and I think the biggest change, we opened up in 2012. I think those first few years we were getting 90% locals that were coming over to the bars. I mean, we felt like we really built neighborhood bars. On the Fremont Street Experience right across the road, we would have people that would walk right to the very end, get to Las Vegas Boulevard, and then turn around and walk the other way. I think, starting 2013, there was like enough twinkle on that side of the street for people to cross over. There might as well have been a wall there as opposed to a bridge for a long time. I think, as it got developed, people started venturing further and further down the street, and Container Park was I agree, a big pivot. You started seeing tourists, you started seeing, the locals that you saw, and then you started seeing families, like we affectionately call it stroller count. When stroller count is really high, we feel like it gets safer and safer down here because we see people walking around with strollers and families. But going back to Project Enchilada, which I know we're going back to, now that all the trees are there, festooning lights, they're going to go all the way down from 5th Street to 10th Street. I mean, it's going to be, even more twinkle for people to come across the street and come check us out.
So that stroller count, are we seeing an increase? So we're looking at kind of a trending
every
line
year.
Up every single year?
Every year it goes up.
Interesting, yeah.
But I think the one thing too, just to layer on to what Ryan said and what Brad said, just about, building this for the locals, like Ryan said, getting locals here, and that Brad had mentioned that he's doing what he's doing for the locals, and I can't tell you how often I hear that people want to go check out what the Las Vegas locals do, right? And everyone's so curious about what Las Vegas folks do and where they go and what their experiences are like here. So I do think that naturally drives people and visitation to downtown. If we just focus on what the locals are looking for, then the tourist will come.
Back in October, the city of Las Vegas unanimously approved the purchase by developer Jay Dapper and rehabilitation of the historic Huntridge Theater. We talked about why structures like the theater are important to preserve. Take a look.
I think it goes back to us preserving some of this history. I grew up in Boston. Old is 250 years for a building. You go to Italy and old was built by the Romans. Here, old is 1991 on the Strip. So, the fact that we're taking something that was such an important part of, Vegas back in, the old time and vintage time of Vegas when it was special and special now. But it's great that we're keeping some of these buildings and to have someone like Jay Dapper come in who's, can really get it done right. Everyone's excited to see a redevelopment of an iconic building like that.
Early on, after news broke of the first COVID-19 case in Nevada, we had a show on exploring how prepared our state was to handle a widespread pandemic. It's fascinating now to look back on that conversation on what our precautions and containment strategies were when so much was still very much unknown. Even more significant now as we hear news of potentially more contagious COVID-19 strains evolving. Let's take a look.
You know, something that is fascinating about infectious diseases is it's probably one of the few fields in medicine where your target or the organism that's causing problems is also constantly evaluating. So there is always a risk of a new outbreak because these are organisms that are evolving and changing. Just to give you an example, about a decade ago, nobody had heard or talked much about these multi-drug resistant bacteria that we now see in our hospitals. These organisms that are at least in our hospitals, referred to as carbapenem resistant organisms. This is an evolving threat right now to our community. We constantly get numbers from the Department of Health. So infectious disease, just by the nature of the specialty, is constantly evolving because your target, which is these microorganisms, bacteria, fungi, viruses, they are evolving as our treatments and methods to detect them change as well. So that's what's so fascinating and challenging in a way about it.
Fascinating, challenging, and also concerning if they're evolving
absolutely.
At that level. And Brian, let's talk a little bit more about this on just maybe the epidemic level. First is, if we are confronted with this and these types of evolving issues, how well are we doing then managing these if we're talking system-wide here in Southern Nevada?
We have a health department that's able to respond to all the challenges that are put out by our community. We know that diseases are coming in all the time. We know that people are bringing diseases to Southern Nevada all the time. And so our system is built around that idea. We're always doing surveillance for disease. We have a system in place to respond to any outbreak that's actually there. And even if it's a brand new disease we haven't seen before, we have public health methods we can use that will allow us to stop the spread of the disease, even if we don't have a vaccine, even if we don't have a treatment, even if we haven't identified what that bacteria or virus is.
Can you expand on that? What are some of those methods?
So we have things like isolation and quarantine. If a person gets sick, we want to put them in a hospital room where they can't spread it to other people. But beyond that, a public health measure we frequently use, and one we're seeing with coronavirus now, is we use quarantine, which means we take people who've been exposed and we keep them away from other people so that if they were to develop the disease, they wouldn't spread it to the next generation of people. So if you start with a sick person and kind of make a ring of people around them, you can essentially contain that even if you don't know what it is. So even if we haven't developed that lab test yet or the treatment, we still have public health methods we can use to control disease.
Also, our overloaded hospitals currently shine a spotlight on local healthcare and public health workforce gaps. It's timely to revisit a discussion we had as well and consider future measures to build a more robust workforce. We have pretty widespread workforce gaps when we're talking about just our healthcare system in general, especially physicians and nurses. When we're talking about something like a pandemic, I don't want to assume too much, but I'm going to assume that the amount of personnel that we need to treat something like this, if it were to hit this area, goes up exponentially. For one thing, could we close that gap on our workforce and be able to have the capacity that we need?
Well, there's two different parts of that. There's the public health workforce and there's the healthcare workforce. So when an outbreak happens and you have thousands of people showing up at a hospital, you don't need 1,000 more epidemiologists to track how many people are there. Yes, you do need a few of them, but you don't bring them in just at the time of an outbreak. They work year-round to identify these problems and track things that the public never hears about. The gap that we really see when an outbreak occurs, like they're seeing in China right now, is a shortage of healthcare workers and healthcare beds just to take care of that sheer number of sick people coming in all at once. Building a public health workforce is a long-term thing that provides kind of that the background prevention all the time. One of the problems we have in Nevada is we're basically the bottom of the list, like we are in a number of other things, in funding public health. So the money is just not there to hire people. I'm sure Dr. Lugin could handle twice as many people there and still have jobs for them and be able to do things. We just don't have the funding to do those sort of things in Nevada. We don't put a priority on public health here, and that's why we're at the bottom of the list. And so it's a big challenge to put that system in place to prevent these outbreaks and track them. And then there's that whole separate issue of the healthcare system and all the limitations we have and just the number of staff and beds and things like that.
By April, because of COVID-19 containment restrictions, we halted our in-person shows and went to a virtual roundtable. One of our first conversations was with our chambers of commerce to discuss how small businesses were faring after CARES Act funding passed. Now, as Congress just approved new federal relief again, let's look back on that conversation and how important small businesses are to our state's sustainability and our recovery.
I'm not very good at being diplomatic about this subject. Here's the deal. Access to capital is difficult even during normal times for small businesses. And then if you're a minority-owned business, it's another whole layer of frustration where it's almost impossible to get access to capital. So I'm hoping that this money lands now, and I'm hoping that what we've learned from this is that we have to give access to capital to small businesses. They are the engine that runs this community, this country.
And it's like Peter said, we have to get this cash into the hands of these small businesses because they're the fabric of our community, they're the economic engine, and they're the ones who will make or break the future of this entire country if we don't step up and help them as soon as possible. And that's the other thing a lot of our members were saying, the tax breaks are great and all the other aspects of some of these programs that are being offered, but if they don't have money, there will be nothing to pay taxes on anyway. So the key is to get this cash into the hands of these businesses now.
Something else we talked about on this show that is even more relevant now as we confront the current spike in cases and related state-mandated restrictions is what our role is, what we can do to help local businesses survive as we wait for widespread vaccine distribution. Let's take a look.
Well, I think going back to the restaurants, a lot of those places are doing takeout and they're doing delivery. Try your best to support them if you're going to get anything outside of your home. Make sure that you support the local small businesses because that's what we've been trying to do on a regular basis because we understand that any cash in their hands is going to help them out.
The Vegas Chamber is in the early stages of putting together a program right now called COVID Kindness. And we're working with the Las Vegas Metro Police Department's foundation to set up a gift card program where you can go on the website and purchase a gift card from any company in Nevada. We're going to run it across the entire state. It can be our members, it can be Latin Chamber members, Urban Chamber members, anybody can buy a gift card from a business. So that helps put money into the pockets of our companies. But through the Las Vegas Metro Police Department's foundation, those gift cards are going to be donated to first responders like police officers and nurses and so forth. So that's another way that the Vegas Chamber is trying very hard to get money into the pockets of our businesses.
And COVID Kindness is up and running and can be accessed by visiting the Vegas Chamber or Nevada Week's resource page. Now, something that might have been slightly lost in the fray of COVID-19 in the election cycle was our census count, which occurred from March until October. We wanted to revisit some of our Nevada Week conversations as they're very relevant to COVID-19 response and recovery in the future. Now, this particular episode was the last in-studio conversation that we had way back in February before social distancing restrictions. Now, again, small business was top of mind. Take a look.
One of the things that the census does for us is gives us a solid count of how many small businesses and how many minority businesses. Like we are hearing that, the next count should be around 300,000. According to some of the numbers we've been hearing, it'll be about 300,000 small businesses in the state of Nevada. And we're already trending over a third of those being minority businesses. And roughly, the challenge is those numbers, if they're not counted right, then we miss a lot of information, right? And I know recently the previous numbers, there were about close to 9,000 Black-owned businesses, and that's roughly around right around 4% of the small businesses, and so the challenge is understanding what dollars need to be allocated where the Nevada SBDC, SCORE, all of the different SBA programs, the Women Business Center, how do they help unless they understand the data that is associated with our small businesses.
And Shondell, SBDC, what is that?
The Nevada Small Business Development Center. So I just recently came from Washington D.C. to look at the allocations for the states. And that's another issue, right? Because that's how they allocate dollars through the SBA. For the Nevada SBDCs, they look at the state population and they allocate dollars that way. So one state or the other won't miss out unless they don't get counted.
And Shondell, we had you on a previous show. It was a while ago, but I remember we were talking about One of the big barriers of small business growth, especially in minority-owned business populations, is access to capital.
Absolutely,
Is
yes.
that directly related to census numbers?
Absolutely, yeah, because one of the things that when they look at resources nationwide for the Small Business Administration, they look at your census numbers. They look at how many minorities you have or how many small businesses you have, but also they look at the population. So federal funds are typically allocated based on the population. So that will help us when we want to get small business development dollars, and understanding that most minorities are first generation. So those small business development dollars are very, very important because they're not being taught by a previous generation, they're being taught by the SBA.
As we move out of the COVID-19 crisis and into recovery in 2021, more federal funding for things like education and economic recovery will be a focus. We had several conversations about the importance of an accurate census count on education and getting our fair share of federal dollars.
If I wanted to go back and talk about children programs for a moment,
yes,
because we've talked about like Medicaid and highway construction, but the programs helping our children in Nevada that need our help the most, I'm talking about subsidized school lunch, subsidized school breakfast, Head Start, foster care grants, special needs grants. All of these are based on how many children we report to the Census Bureau every 10 years. And I like to make a special point of this. We missed 5 million children across the country in 2010. And here in Nevada and Clark County, we can't afford to do that.
Well, and that's a special point to make too, is we've seen the growth after the Great Recession. Of course, Southern Nevada recovered, and now we're seeing booming growth again. So we're getting an influx. I have small children at home that are in the schools. We're seeing an influx of kids and seniors, and with them coming in, that's why it's so important, because things have changed significantly over 10 years in Southern Nevada. And if we don't get everybody counted, we're going to be in that same situation. And it's going to be a dire situation, I think, in Southern Nevada.
And let's use something that's just talked about quite a bit in the state. If we're talking about maybe a low count, per pupil funding, is this something that if we have a low count is directly affecting what our funding is?
Oh, absolutely. A lot of federal funding is derived, our education funding is derived through the census, and that money goes directly into our schools. Now, when you're looking at $20,000 per person, so if a family of 4 fails to get counted, that's $80,000 that you're looking at that the state is going to lose out on over the course of 10 years. And that's an enormous amount of funding when you look at the overall population of what Nevada has. You know, we're looking at upwards of potential $60 billion in federal funding coming to Nevada if we get, I think it's closer to 70, if we get an accurate count and everybody is counted and we receive the funds that are fair from the federal government.
And it's important to note that $20,000 ratio there. If we look at even an undercount of less than 0.5%, we're talking about billions of dollars here we're losing.
Oh, it's enormous. You know, when you extrapolate out the total dollar amount, it's absolutely incredibly large. And when you put it in the scope of one person, one individual person is $20,000. That's a lot of money. I mean, we can fund a lot, whether that's, you know, teacher salaries, whether it's, you know, better lunches for the kids, more nutritious lunches. It's some of our infrastructure improvements that need to be approved. It could be our, you know, our roads that need to be done, and building more schools, and providing for public safety. I mean, these are all issues that are derived as a result of our participation and collaboration with the federal government, and that's directly impacted by an accurate census count.
According to the Census Bureau, Nevada's self-response rate in 2020 improved slightly from the last census in 2010, from 66.5% to 66.6%, just below what the national average was of 67%. Now, in the aftermath of the George Floyd murder in Minnesota and local protests, we went back into studio in June for an important and socially distanced in-person conversation. We sat down with law enforcement and racial justice advocates to get more comfortable having those uncomfortable conversations around local racial issues and solutions. And these conversations continually seem to loop back to what community means. Let's take a look. What do you see as top of mind here? What are some changes that can be enacted, you think, that can really lead to some of the reform here?
Well, I think we have to, it was, as we've said earlier, it's, there's been a lot of reform and a lot of changes that have come about. I think the Department of Justice, when they came in and looked at us and examined us in partnership with the community, there were almost 80 recommendations, and every one of those has been implemented. I think that where we have also made changes since then. We've implemented training on bias recognition and fair and impartial policing. That needs to continue. Those things need to continue to grow. Those programs need to continue to touch all of our officers repeatedly, and we've expanded that even to our civilian employees as well, so they understand and recognize their own biases and making sure that they don't make decisions based on a bias. And I think although we have a very strong relationship with the community, we need to continue to expand those relationships and bring more people to the table, because it's not my police department, it's the community's police department. If we can do anything, today, what we need to do a better job of is encouraging and finding more people from minority communities to come and join the police department. Our demographics, we're not reflective of the community we police. And there's a variety of reasons why we have trouble recruiting in the communities that we serve. But that's one area right off the bat that I think if we can change that and start to change the demographics of the police department a little bit, we'll be more reflective of the community we serve, which then internally we have more of a voice.
What about joining, like the gentleman that committed the crime in Minnesota, he was a 19-year vet. 2 of the other officers didn't have 3 years combined. So when it's embedded, it's kind of embedded. If you had 2 new rookie cops that are with a seasoned vet that's showing you the wrong way, it is what it is. So I'm leery about even changing police forces. Do I want my son joining the police force? That's what my lens, that's how I look at it through. Yeah. You think, buddy, you can change the actions that have been embedded in this systemic racism? Good luck to you. We gotta dig a little deeper, and it's not that law enforcement is one finger on the fist.
And
I agree.
Andrew, I was wondering, I heard Chief Lombardo talk about this specifically, of just the systems that have been employed internally to where you do have the bad apple police officers, that they're identified rather quickly.
And I think that the bad apple thing has gotten really old for the community to hear, because, you have more history than I do, but I'm old enough in this profession to remember Rodney King with a few bad apples, right? I think that we have to recognize that might be true. I mean, I think for the most part, I think people agree that police officers, we see enough of the heroic stories to know that they do good work and they do the right thing. But we do have those issues. So a great question, because there was a story that was sent to me last night from a friend of mine that in Fort Lauderdale, there was an officer that at a protest, he's getting screamed at, and he turns to walk away, and there's a protester. If you haven't seen the video, you need to see it. There's a protester sitting on the ground, and she's got her hands up. And this officer turns, and as he's walking away from the person screaming at them, he walks towards the protester sitting, and he knocks her down.
Yeah.
Did you see that one?
Yes.
So it came out this morning that when they did, or yesterday, he's got 79 use of force incidents in 3.5 years. Now, I know what that means for us. I know what we count as a use of force incident. I don't know if they count a handcuffing as a use of force. I don't know how they calculate that.
That's a lot.
But there's no way to couch it, right? That's a lot of use of force, and so yeah, that wouldn't happen here. But I can't argue with what your life experience is. I don't even want to. I want to know, how do we make it better, and that's why this is important.
I think there are police departments that are cleaning themselves up. Montgomery, Alabama is a wonderful police department because they listen to their community. Yeah. They have people come in from the 1960s, the civil rights movement, and they listen to them.
Look at Camden, New Jersey, another one.
So we
they
know
closed their whole police department. They closed it and then rebuilt it.
I got a baby, because it's hard. I'm such a rated R realist. The hope, it's hard. But I guess Ferguson just elected a black mayor.
Yes, female.
A black female. First
female.
It gave me some
hope.
And that's
my
why
son saw
because
it
black women are not scared
in a fight, and just for that to happen, it definitely ignited that community. That would not have happened without what they went through. So 6 years.
Yes.
It definitely, and I'm going to reach out to her specifically because it touched my soul.
Of course, we had important elections in 2020 as well. in a state that results may show is still very much up for grabs. Take a look.
I was not expecting this sort of national lens to focus in on Nevada and our, six small number of electoral votes to suddenly become that important. And so I think that was a really interesting development. But it kind of just went to show, I think, we are an important state. You can't take anything for granted here. I mean, Democrats and Republicans alike have been saying that.
I think one of the takeaways from this, for me, is how we judge battleground states like Nevada. I know Megan said this, and I think she tweeted it on election night, that people have this comforting view of Nevada, or Democrats at least, comforting view for Democrats that this is a strictly blue state, and it's really not. And I think that it will be a battleground going forward.
I think for me, it kind of building off what John mentioned, is kind of Nevada really showing its independent streak once again in this election. But down the ballot, Republicans really made up a lot of ground, especially in the state house where they had struggled in recent elections. And that really just showed, I think, a kind of a renewed effort from certain groups of Republicans, certain sects of the Republican Party, that they know that this is not a blue state.
Thank you for joining us this week on Nevada Week. Now, for any of the resources that we've discussed on this show, please visit our website at vegaspbs.org/Nevada-week. We look forward to returning to you next year, and we wish you all the best in 2021. Thanks again, and happy holidays to you and yours.